Antibiotics can be the best defense against certain illnesses, but if given for the wrong reasons or prescribed too often, they may not work. A local pediatrician answers 4 key questions when it comes to prescribing antibiotics safely and effectively. At Eugene Pediatric Associates, pediatricians are often asked about antibiotics and why are they not prescribed for certain illnesses.
The vast majority of illnesses that children get are viral. Viruses don't respond to antibiotics. Antibiotics are specifically designed for bacterial infections, which are less common but can be severe.
Since some viruses can turn into bacterial infections, why wait to start an antibiotic?
Proactively starting an antibiotic before a bacterial infection is not recommended, mostly because if you do that, the bacteria are smart. They will figure out how to survive even in the presence of that antibiotic.
Is there a way to tell if my child's infection is viral or bacterial?
And the answer is even doctors are trying to make educated guesses often. There are some lab tests and swabs that we can run, but typically we can examine a child and feel reassured or not based on how they present in our office.
How can I use antibiotics safely?
Make sure to follow the directions on how much to give, how often to give it, how many days to give it. Don't keep any leftover antibiotic for future use, and don't share antibiotics between siblings because 2 kids in one house with one germ can present differently.
It's also important that you don't skip doses or stop antibiotics early, even if your child is feeling better. Learn more about antibiotic use at eugenepeds.com/healthykids. I'm Kelly Warner.